Welcome to Healing Through Dentistry podcast,
where we redefine health, wellness, and the power of your smile.
We're your hosts,
Hanna
and Eva, twin sisters, qualified dentists and medical doctors.
This is more than a dental podcast.
It's a journey into profound connection between oral health and whole body healing.
Through personal stories, inspiring client transformations, and expert insights,
we explore how dentistry can ignite energy, relieve chronic pain, and transform lives.
Get ready to discover the extraordinary ways your smile can heal, inside and out.
Let's begin.
Hi, and welcome back.
Welcome to the next episode. We would be talking about wisdom teeth and all surgical procedure in dental clinics.
So, do we need wisdom teeth, and do we always have to have it removed? That's the most frequent questions we get. So maybe let's just start answering those.
So we always consider a few things before saying if we need wisdom teeth or not, if they should be extracted, because lots of times you hear they don't cause any problems, we will leave them there. Well, part of the story, I would say, because we see the clients in a whole body view. So we do ask them questions. Is there anything in your life you are dealing with? And then we could say a few examples. I do it this way. Is there anything with your digestions or with your heart? And I usually pick the things which are connected with the wisdom teeth. So they would tell me, okay, well, I actually have arrhythmia and I am seeing my cardiologist every 3 months. So that's how we unroll the story, because we know, according to traditional Chinese medicine, that there is a link between these organs. So the main organs are the small intestine and the heart. But we have also clients who tell us they have elbow frozen or tennis elbow. And we have lots of stories which are beautiful, that they have actually lost their symptoms. They don't see cardiologists every 4 months and they don't have any elbow issues. So we do ask these questions holistically, and then we see that the wisdom tooth has space or has no space to be in the jaw. So usually, and I think it's a majority of people, we don't have space for wisdom teeth. And that's why there is chronic inflammation developed.
And maybe why do you think it is, Eva? Why do we have no space?
Well, that's back to nutrition again, back to how the jaw is developed. Well, even 100 years ago, there was not enough nutrients in the soil. So that means that it's not in the foods we eat. And the studies were that the jaws were becoming smaller and smaller. And also...
So it's an evolution almost, right? I remember reading somewhere that thousands of years ago, we used to have 9 teeth in one arch. So we didn't have like wisdom teeth, tooth number 8, but we used to have tooth number 9.
Clients, they still do. So.
I've seen that a few times in my career. You did too? I've probably seen too.
A few times.
Yeah. Another reason why is also the lack of breastfeeding from mothers and the lack of chewing hard foods. So the first one being that people don't realize, or mothers specifically don't realize, how important is breastfeeding, not only for the nutrients from the milk, but also from the perspective of development of your jaw, of your baby's jaw. So
extending the palate.
Yes, the sucking motion basically trains your muscles,
forms your jaws.
So it is very important to breastfeed if possible. And also the lack of eating hard foods by children, because like in these modern days, like mothers get option. There are a lot of smoothies. There are a lot of,
I think that's the past decades. We have modern world taught us to use blenders and use mixing tools. And that's actually not good for the development. So I always tell young moms, young dads, that the kids, they should eat hard nuts, carrots and food which is hard in order for the jaws to develop the spacing for the adult teeth.
Yes.
And we have little interruptions from Goldie.
No, that's Husky.
Or Husky, she has dreams. So we will let her have her dreams and we will continue about wisdom teeth.
Maybe she was agreeing with us in her sleep. Anyway, that's funny.
So we were talking about the spacing, about development of the jaws and about hard food and evolution.
So basically no blenders. Ideally, obviously, like very small babies do need to blend stuff, but then once they're ready to, chew, they should be chewing, the whole foods.
And breastfeeding, the major thing, that's the beginning.
And even if they don't have a teeth, they do already train their jaws and their gums, and it actually helps them with teething, with like evolving the teeth, because again, like nature is clever. So if they see that someone's not using it, guess what? Like they're not going to promote it, right? So the kids really can have even their teeth later because they're not stimulating the bone and the gums. Their brain doesn't get the signal, there should be a tooth soon. So it's very important.
So lots of us, back to wisdom teeth, they have no space for wisdom teeth, and the chronic inflammation is created by the fact that we are not able to clean that area in a way that we are cleaning the other teeth.
Yeah, imagine it very simply. Imagine that something's like out, but not out fully. So if you don't have anything out fully, that's most of the wisdom teeth we're dealing with. It is still not fully in your mouth, and it is oftentimes covered with your gum. And the gum almost forms like a pocket, we call it, because it's really like a pocket. If you put your hands in your pocket, that's like a pocket above.
A storage for the bacteria, for all
your
the
teeth.
Inflammation. And you can feel some signs when the cup is overfilled. So usually clients, they come with wisdom teeth issues after years and years, or they come and they say, my dentist said it's not necessary to remove the wisdom teeth, I'll leave them in. So our opinion.
Yeah, maybe let's just stop there, Eva, and just say because that is really important. Most people do come when they do have a problems, but with teeth, only teeth. So if you do, it is very easy for all of us in general, just say, okay, something with my wisdom teeth. If I do get wisdom tooth pain or like a pain in area where the wisdom tooth is, or some people do perceive it very well when they do have a jaw pain or ear pain or migraines. That's kind of a less of symptomatic for the tooth, as in like, okay, is that the tooth? Why do I have a migraine? But we go even further from Chinese medicine perspective, like Eva said, because every tooth is on a meridian, meaning on a line, on a path connecting the rest of the body. And the wisdom teeth, together with premolars, have got a major key position for the body, because not only they're like main organs like a heart, also a small intestine, but they are key major position because they do have to do a lot with the central nervous system and peripheral nervous system. So symptoms like toothache is easy, but we do kind of so-called opening the doors to people to perceive they do not only have to have teeth problem if it comes to teeth, because
it's all connected.
It's all connected. So you might have palpitations, you might have high pressure, blood pressure, but you might also have anxiety, depression,
or low energy levels, because it's also the energetic area.
Chronic fatigue.
Body. So that's more complex. So that's what we would like to point out, that it's not only the tooth which we have as a matter of fact, like in the mouth, but it's a whole body. Well, how do we see the inflammation? There's lots of clients, they ask, how do you see it's there? Well, first of all, clinically, you see that the gum is swollen. There is a pocket. The pocket is usually 10 millimeters. There is a swelling around it.
Sometimes more. I wouldn't just bring numbers in.
No numbers involved, but there is swelling of the gum, and it's usually red or purple and it's not the same color as the rest of the gums around.
I think
other
for people, it's easy to see it in their mouth, like two major. It's swelling and it's bleeding. When you touch it, when you brush it, when you poke it, you get bleeding. And that's very signaling that there is inflammation.
Mm-hmm. And the other fact is you see on a radiograph that because the inflammation, we talk about acidity, toxicity of the bacteria, the acidity is resorbing or damaging the bone around the wisdom tooth. So we see that there is a bone missing around the wisdom tooth. So that's why I know immediately after a few seconds seeing the x-ray that there is chronic inflammation.
And that's x-ray. And then another level up is a CT scan, which is a 3D dimensional x-ray. And that is just show us even more in detail what's going on. Where is the resorption of the bone or where is the chronic infection?
And also position of the nerve, of the canal where the major nerve goes. It's a head nerve, which is supplying all the side of your face, which is called trigeminal nerve.
Trigeminal, I don't know how to pronounce it, but it is actually, it's got three main branches, and that's why I was talking about the pain in your tooth, but pain in your jaw as well, pain in your ear, and pain in your head, because there's like three main branches, which it's a nervous system which supply these three regions. And because it's one of the 12 head nerves, it is just so more saying it must be connected to the rest of the body. And it is.
Yeah. And I sometimes Google images for clients to see just the nerve system of the body. And if you Google that, you will see that it would create the whole body, and it's all yellow because that's the color for the nerves. So it's all connected. So we see transformational stories in terms of after wisdom teeth removal, what happens to clients, how they heal, and more we stress to be ready for the extraction with a special protocol to get the body ready to be full of nutrients. For that reason, that body can have building stones to heal. Because if the body doesn't heal in a primary way, if I don't have building stones to heal the wound after extraction, which is, if you imagine the root, so that would be a socket left out, then it doesn't close properly. So we would develop cavitations, which is another hidden source of bacteria and chronic inflammation for future. So the best is to get ready for the extraction and be prepared for the extraction. Don't do it just because I have toothache. We have to prepare for that.
And again, that is bringing us back to repeat the bone healing protocol.
Yes.
Because how do I prepare? Most people think, okay, I need to prepare myself mentally that I'm just going to lose a tooth or financially as well. But that's not all of it. We do mean by preparing yourself by minerals and vitamins and immune system. So your body actually is strong enough to heal the after extraction area. So I probably would talk about the protocol, how we do the extractions in the next episode, Eva, because that's going to be probably longer. But I maybe recap like the question, do we need wisdom teeth? So the simple answer is no. And especially not if there's inflammation. Yeah, so obviously, if the tooth is okay, that's fine. We recommend to leave it. But if there's signs of inflammation, we do recommend to take it out. And that's the other question. Do they always have to be removed? No, they don't always have to be removed. Again, that was the same question in the different words. You only need to, or we only recommend to take it out when there is inflammation and where we see a bone destruction and chronic inflammation, because it does not affect your wisdom tooth only and the area around that, but the whole body, like we've just described.
And one powerful story to close up this episode would be the one which for me is the beautiful story of a lady who has sessions with a cardiologist every 3 months. And she used to have arrhythmia. She had to have checkups every 3 months. And after the wisdom teeth were removed, she no longer needs to see the cardiologist. And he actually said there is no need to come to see him. There is no signs of arrhythmia anymore.
Yeah, that was powerful. Again, I was seeing her over, now I've seen her over 7-8 years. And probably 6 months after the removal, she was having a checkup and they said, okay, well, we don't see anything anymore, but let's check you again. I see she's very improved. And then another half year after, she was seen by a different specialist and he was confused why she sees them so often because there's no reason. So that was a beautiful story and how the wisdom teeth are connected to your heart. If someone wants to read more about connection, heart and teeth, Dr. Levy and his books are great. It's called The Hidden Epidemic, I believe. So look it up. That is great source.
And he's actually amazing doctor because he's encouraging, he is there and he's encouraging all the dentists in the world and pointing out how this is important to look at wisdom teeth in a holistic way, that he sees a direct link with the heart.
Yeah. So he's encouraging all the dentists and all the cardiologists to cooperate because there's a strong link, which, if you see it, you can help so many people to thrive more or not to be ill, really. So amazing sharing, Eva.
Let's see you in the next episode.
Can't wait for it.
Thank you for joining us on Healing Through Dentistry podcast.
We hope today's conversation has inspired you to see your smile as the gateway to whole body well-being.
To stay connected, visit us on our website or follow us on social media.
If you enjoyed this episode, please subscribe, leave a review, and share it with someone who could benefit.
Until next time, remember, healing starts with a smile.
Take care,
and we will see you in the next episode.